pledge allegiance to the flag of the United States of America, and to the republic which stands one nation, indivisible, with liberty and justice for all.
All right, so how about
Commissioner Hoffmeister?
here?
Commissioner Houts?
Here.
Commissioner Leininger? Commissioner Collins?
Yes.
Commissioner Schaefer?
Here.
Commissioner Stoll? Thank you.
Okay, it's brought to approve the agenda. I just had a chance to check that out. Make a motion to approve the agenda as presented.
So geez, never the ear doesn't feel like I'm not.
I appreciate that support. I know that was confusing for you. Who is this for?
You got it. I'll get it.
All right, all those in favor say aye.
Aye.
Opposed? Carried. How about the minutes from November 13th?
I move to approve the minute of the file.
Support. Directions. Minutes from November 13th. Discussion on that. Hearing none, all those in favor say aye.
Aye.
Carries. We're up for our public comment here. Yes, have anybody that's gonna do that, so how about our health officer?
Good morning.
Morning.
So lots of business items today. We'll start with a budget amendment, or at least it's in there somewhere. We also have the direct care worker health project, which we brought to the finance committee and discussed, and is before you today. Laura can provide more detail on that project. We have a proposal for employee wage for calendar year 2026. My health officer contract is provided today as well. And that's a 3-year contract. So as we had talked about before, staffing update wise, our current openings are only one, an immunization clerk in St. Joseph County. We also have before you today a proposal for the agency to engage a contractor for a community health needs assessment, community health improvement plan, and finally that will lead us into strategic planning. We have worked with that contractor in the past, Mary Cushion, and she did a real nice job for us 3 years ago, and we wanted to engage with her again. So the funding for bringing her aboard to do that work will be covered by the infrastructure grant, and that is an allowable expense. So we hope that you will move that forward today and we can engage with Mary and get going there. The agency is currently investigating some chickenpox cases and have worked with one school on some exclusions of kids that are unvaccinated or under-vaccinated at this time. So, and I just provided the information on chickenpox that we put out in our press release for you here. So if you saw the press release, this is just identical to the information we shared there. The final arbovirus report for this year is included. I did have Joe report yesterday because he attended the final wrap up of the vector grant meeting that our Lyme disease tick is of particular interest in Michigan.
So Michigan is now considered a higher incident for Lyme disease. That's the first time a state's been bumped to a higher level for quite some time. So in 2026, that's what Michigan will be labeled as. The numbers were going up across the states.
So we see a lot of those West Nile virus cases these days. Not Lyme disease. Sorry, I said the wrong thing. Lyme disease. All right, and then finally, seasonal immunizations. While I was writing this up, we were doing National Influenza Vaccination Week at the health agency. and had some additional opportunities for people to come in and just get their flu vaccine. We, of course, can continue to offer that vaccine along with other respiratory disease vaccines and welcome anyone that's interested in receiving that. So if any of you want to take advantage of that while you're here today, we'd be happy to take care of you. Our mobile unit is continuing to be on the road. We sought some feedback from the Waldron area. We weren't seeing much traffic there, so we sought out and asked for some feedback, which I think was helpful. We learned that individuals were thinking that this was just new signups only and not WIC services for people that are already established. It can be either, both. And so we changed our messaging around that to better message that all WIC services are offered. It's not just for individuals that have never signed up before. And we're hopeful that that, along with changing the message around other things that we can do with that mobile unit, such as bring vaccines with us, that will increase use of the unit. So not just in Waldron, but also in Litchfield. So we changed those flyers, and so they both speak to all services are available. Immunizations are also available. We do need people to call in advance if they want to take advantage of immunization from the mobile unit. We don't want
Charges for immunizations.
charges for immunizations, Heidi.
Yeah, I mean, we'll do like we do here. We'll check their insurance first
Okay.
and see what options we can give them. That's why we want to call ahead of time. We know which to bring.
Yeah, I was just curious. A couple patients, shingles vaccine.
Yeah, we can probably do that under Transact and check all their options first.
And if they lack insurance, we have the adult vaccine program. And of course, there's the childhood vaccination program as well. So there are other options too for vaccine cost if they qualify. So
Was that new flyer sent to Mike Warner, the newspaper guy?
I don't think it was.
Mike Warner sent it to him because he puts that in the paper once a month when it gets ready to come to Litchfield.
Okay, I'll do that.
okay, great. All right, and Hillsdale Hospital is continuing to use the mobile unit as well. But it is my understanding from talking with the CEO, JJ Hotshire, that they aren't going to Waldron at this time. They weren't seeing much traffic there either. And so I believe they are at Camden and then at the Hope House in Hillsdale right now, offering services. As far as our buildings go, there's nothing to report about Coldwater at this time. In our Hillsdale office, we have put out a request for bids on our website. And next step is to engage with the building official in Hillsdale County to ask for their assistance in sharing that, as well as just reaching out to local HVAC contractors and making sure that they know that the request for bids is out there on our website. That is due in January. And so we wanted to make sure people got through the holidays and had some time to be able to submit a bid for that project. That work would also be covered under the infrastructure grant that we have, just like we've done the painting and the exterior buildings and stuff. Nothing at Sturgis and nothing at Three Rivers. So that is what I have for you today.
I was curious, I didn't see it in here, but which area had chickens?
Yeah, it's, we initially just indicated it was within the jurisdiction. But I think it's pretty common knowledge at this point that the cases are located in Hillsdale County. So, yeah. They could be anywhere. Yes. They could be anywhere.
Yes,
You know,
I know.
Me, I haven't heard of it.
Oh, it's on social media. It's being talked about in and around town.
You know,
So,
and I'm sorry. I would
contend, take the opposite approach. When I was young, there was no such thing as a chickenpox vaccine. You got chickenpox, you dealt with it, you got over it, going back. You know, to say, well, we're gonna include kids who are under vaccinated, not vaccinated, I wouldn't do it. And I would say that we're taking the wrong approach from that. Best immunization is getting the virus, recovering from it, and then you're immunized.
Parties.
I mean, yeah,
Remember,
Yeah.
exposure
Yeah.
is the best immunization.
exactly, so.
Well, I think it's more than the immunocompromised.
Yeah.
Children.
I think that's a challenge. Yes. It may affect you differently.
That's debatable.
Yeah.
That's tough there, right? As most do.
All right, thank you for that. We go along here to our medical bridge.
Okay. My report's in your packet. Our winter provider newsletter should go out tomorrow. So that's good. That has some updates on, respiratory virus, radon, chickenpox issues. Because, one thing with chickenpox is sometimes people will say their kids had chickenpox, but it has not been confirmed by labs, right? You should swab those lesions so that we actually know what's going on and if it's really chickenpox. So that's kind of a big thing in the community too. People are like, my kid had chickenpox or had chickenpox, and then it's not really confirmed. Then we're at a loss for a little bit of a loss for what to do. So we're kind of putting that in the provider newsletter that it's good to confirm, and then also let the health department know, because we need to kind of follow with everybody else. So my educational report is on radon, because January is Radon Awareness Month. And we've talked about radon before. We have free test kits here, so it's always good to get your home tested, especially when you look at the map at the bottom of the page, where our counties are pretty significantly inundated with radon in our soils. So it comes from uranium in the soil, and as it breaks down, we get radon, which is a radioactive gas, but obviously colorless and odorless. So you think about the amount of time that you might spend in your basement, like we have our little workout area in our basement. We're down there a lot. I have a little craft room down there. We're down there a lot. And, you know, it can seep through cracks in your foundation, and then you would have some problems, right? So it's the second leading cause of lung cancer. So smoking is obviously first, and then radon exposure is second. And it comes from years of exposure, right? If you're in somebody's basement with some radon for a few hours, you're probably not in any danger, but it comes from years of being exposed. And the EPA estimated about 21,000 people died last year from radon. Very similar symptoms to lung cancer, a persistent cough, some hoarseness, and wheezing, maybe coughing up blood, weight loss, fatigue. So we really need to think about it in our counties, because again, that map shows that we're at serious risk. So, and you can do things about it, right? So you can test and see what your radon levels are in your home, and then you can set up some proper ventilation systems and better air exchange. So I think a lot of the newer houses now, I'm sure other people know more about that, are equipped with ventilation systems just in case. Like when we built our house, which was 20 years ago, he put in a system that just in case we had some radon, we already had some sort of ventilation system. We just had to hook up something else.
It's actually building code.
Building code now.
Those bottom two tier counties in the red, any new construction, you have to put it in regardless of your testing.
Good, that's good to know. Yeah, that's good to know. Put it right in there just in case. Again, so you can pick up a free test kit here, which has been really nice. I used it last year. I used it, yeah. So always good to know, you know, because you can be down in your basement or anywhere else in your home, schools, or exposed to radon seeping through little cracks in your foundation. That's all I did. Yeah, and the chickenpox thing, I think we've done a nice job. As soon as we found out, we kind of let people know. And you can come in if you've been exposed to chickenpox, you can come in right away and get your first dose of vaccine. And then you're allowed to go right back to school, because that's pretty protective. And the issue really is we never know who's immunocompromised in the classroom. And then somebody brings it home to grandma or grandpa who has never had chickenpox, or who then gets shingles, which is pretty serious in and of itself. So we recommend those 2 doses of varicella vaccine. That's all I have to
So for radon, if you have a workout basement, does that negate that then, as far as?
Not really. You could still have, we have like a partial walkout. And, so I tested in the area that wasn't near my slider, just to a more enclosed area. So yeah, you could, and you can get it anywhere really. You know, I said basement because, you know, it's in the soil.
Yeah.
So, but they've seen it even, you know, upper levels.
So we, there's our subsidized apartments actually have reclassification. It's slab on grade, it's concrete slab, so still.
Yeah.
Tested.
We have a system in our wholesale building. Because our wholesale building has figured out.
Is there available then if environmental health?
They have it, yep. Grab one on your way out. Easy to use.
Thank you. All right, health education promotion.
Yeah, Chris is excused today so that she could attend another meeting for the agency. But really, her report it speaks for itself. The only thing that I would point out is that she does have her new health educators starting on Monday. So she did identify a candidate. That person has accepted the offer and they start on Monday. So AJ, I believe, is the name. I don't remember the last name. I don't think it matters. I'm sure at some point she'll try to introduce her to all of them. So.
Sorry, another guy. Hey.
We definitely are heavy on the female side of things here.
Cares off.
Those bank.
All right,
Morning. So environmental health, we're still busy. On the food side, we just finished up our radio circuit talking about food safety for the holidays. Enjoy doing that. It was fun getting out to all the different counties and chatting with people and hopefully getting that message out there, just because it, like Thanksgiving, there's no stress, there's no gifts, there's nothing. You just get to eat and hopefully watch the Lions do really well, which they didn't, but that's okay. It's a great one for me, and I enjoyed getting out and talking about that. With that, there are more gatherings and going out to eat, parties and things like that. So our staff has been really stressing the personal hygiene, hand washing, the simple things that people can do while out and about to try to keep themselves and their families safe during the holidays. So when we're out doing inspections, we always stress employee hygiene and health, but just talking about quick tips like, hey, did you watch this person wash their hands? Did you watch them change gloves? Are they coming in sick? Are they using the restroom too much? Are they running nose, stuff like that? Are you paying attention? So we're really kind of honing in on that to try to help prevent some of those foodborne illnesses or just illnesses in general. The other thing I wanted to touch on, December 1st, our Type 2 non-community water supply program had their yearly review. Unlike everybody else, Type 2 non-community does a once a year kind of accreditation type of thing rather than once every 3 years. And so our staff, which consists of Kaylee, Jordan, and Kyle, the supervisor of that, had their meeting with Eagle. They came down, reviewed all of our facilities. So to give you an example of what a Type 2 would be, that would be ConAgra over on the border of Hillsdale and Branch, and then Abbott Labs over in St. Joe County. So massive facilities, and think of all the different water connections within those big buildings. That staff is going and making sure that there's no cross connections and that water supply is safe. That's on a grand scheme. Then they go do little places like the drive-in movie theater here in Branch County. They would look at that. So it covers a wide range. The state comes and they look at all of our sampling records, and if their samples were good, and if they weren't, then we communicate, phone calls, they break down all these records, and it takes a couple days. They did a phenomenal job. The state actually took some of the stuff that we're doing, the processes that we're doing, and said, wow, that's really cool. They took that and then they're going to use that as an example to give to other health departments to say, hey, this works. Maybe you guys should incorporate that. So to me, that's a huge deal to be able to say the state's saying you're doing something good. We want other people to essentially copy what you're doing. That's a big deal. So big kudos to those three and all the hard work that they do and how well they represent our agency. So I just wanted to share that with you because I felt it was. So that's what I have for my report.
Thank you. Laura here. Play.
Good morning. We're, it's fun to see a year come to a close and also exciting to see what's gonna be happening in the next year. So my first update that wasn't necessarily narrated in the Services to Victims of Elder Abuse Program update was that we have begun symposium planning for 2026. Our team is looking at venues right now and has nearly secured, I should say. We've gotten commitments from 3 different speakers. One from the Prosecuting Attorneys Association of Michigan, one from the Attorney General's office, and one from the Michigan Dementia. So we are excited to be able to develop this education and collaboration event so that not only our local officials can learn and our local network partners can learn, but we can offer it to surrounding agencies as well. We, in the past, have traditionally attracted a few other law enforcement agencies as well. And so we're very excited to do that. We don't have a date yet because it's still very early in planning. For example, we can't get the ISD until they set their schedule for the next school year and look later into the year. But we're looking at August, September, October-ish. So that's kind of exciting. We're really pleased about the commitments we've already received, especially from the Attorney General's office. We're getting a division chief, Scott Teeter, who used to be the prosecutor in Cass County and has moved up the ranks, and Commissioner Schieffer probably knows him. Yeah, so we're very excited. He was very excited to come and pleased to be invited. So that always feels good. We're still seeing a lot of housing barriers in both counties, and particularly in addition to unwelcome guests in people's homes, and so those associated eviction processes are really time-consuming and kind of an arduous process to get somebody out of your house. So that I just wanted to share those highlights. The Direct Care Worker Help Program is something we'll talk under new business a little bit more about. We did discuss it with the Finance Committee, as Rebecca reported earlier. Kind of a neat little pass-through bucket of dollars to help our local direct care workers with whom we have contracts with through our agencies. So that'll be good. Staffing update. We hope to introduce you in January to a new registered nurse care consultant. So we're in process, and she is intended and supposed to start next Monday. So once that's official, we'll certainly invite her to a Board of Health meeting to meet everyone. My options updates, although I don't have final data as of the time that I wrote this report, I pulled some reports. The extraordinary volume of work just blows my mind every year. We only have one certified counselor in St. Joseph County, and there were a few that weren't able to counsel the full open enrollment period here in Branch County through our site this year. But then we also have 2 counselors here that did phenomenal work during open enrollment and have worked collectively over 400 hours and served over 300 individuals trying to navigate health insurance, pick a prescription drug program, and then just understand the P's and Q's of how much it costs them and how the insurance works. So we're very grateful for our sites and our counselors and certainly our staff for the attention to detail that they have to have for these programs and to serve our beneficiaries. So that's really good. And then I did share a little blip there about options counseling. We're still ready and willing to work with anybody who's looking at weighing their options with long-term supports and services. So I just shared a little bit about options counseling down there at the bottom. So does anyone have any questions? Sure.
For the patient, which one? Program.
Okay.
Not sure whether or not it can help with filing for the paperwork for medical disabilities.
We could
Social
probably,
Security program.
yeah, I mean, we can help people do that, but likely we empower the individual to and acknowledge that, yes, that's the correct information to go in that part. But the individual really should be the one, or their caregiver should be the one to submit it. But we can help people walk through that process and kind of understand things in more plain terminology. As we all know, sometimes those applications are very confusing. Glad you did.
Yeah.
Thank you.
Get involved. It's now a shame.
Okay.
And Commissioner, our community health workers can also help with that.
Okay,
that
that
stuff.
Okay,
Mhm. Yeah, so. 2 resources.
work together.
There you go. Yep.
I do have a brief update from Ashley Ellsworth, our Aging and Community Living Supports Bureau liaison. And she said that on November 12th, the continuing resolution was signed by the federal government. And certain parts of the government through that CR were funded through January 30th. Some are fully funded for the year. So in the state of Michigan and for the Aging Network, we have not received our full notice of award yet. But there are sort of rumblings that we will receive that full award very soon, hopefully by the 15th, we're hearing. The delay is due to the elimination of over half of the staff at the Federal Administration for Community Living. So we were able, or at the Bureau, they were able to push out 3 months of federal funding. So we were able to, in our region, pay for what we couldn't pay for in October in terms of the grant activities with the federal sources. So our cash request this month was much larger than it was last. So providers are set for now. We're still waiting for additional dollars, and we're hoping that those budget decisions can happen before the end of the continuing resolution at the end of January. And she says happy holidays.
DCW health program,
Yes.
have those funds been available for a while? Just want to get out now?
Technically they have, and Commissioner Stoll, I've been, a part of me was very cautious about talking with the board about it early on because of some of the restrictions and the process that the funder was placing upon agencies. So we received $10,000 at the end of March. This was during the implementation of my options, onboarding staff, all of those particular details. And then with the way that they provided guidance on how we had to run this project, said we got to put this on the back burner because we don't have capacity right now. So I'm really glad we did because there are more dollars now available to us, and they've alleviated some of those very administratively heavy processes. So there was an application made, and the application had to be forwarded to the AAA. Then the AAA had to review them and give them back to the provider. Then the provider could go. It was very extensive and uncomfortable. Like we wanted to see how this was going to play out. We're glad we did because they've announced really recently that we could do it the way that we're proposing to the board today in terms of targeted funding for intended purpose. Have a guidance document and put it out to the providers that have direct care workers that serve our clients or clients in the county under annual contract or vendor contract.
Is there a deadline to use this?
The end of the grant term right now is the end of March of 2026. And all of the folks that because we held a provider meeting recently, and they all said, oh, this is wonderful. And if it can be retroactive to October 1st of 2025, that would be even better because sometimes these provider agencies help out their staff with emergency needs. I wasn't aware as broadly as we heard in our provider meeting that people do kind of help out. Yeah, this $100 was really a ding to my budget this month because I had to pay this ER bill or I had to I got the shut off notice and I only come up with, 200 of the $300. So this would be for those types of intended purposes, and we can use the funds all the way back to October. And there is a chance there's more funding too, which is the other nice thing. So we might be able to fund it then through the end of the year if the other funder comes through. So.
Any questions? Thanks, Laura.
You're welcome.
First, health, the business.
Good morning. Just a couple updates. I did include some highlights from the respiratory illness dashboard. Currently, 21.3% of Michigan residents are vaccinated for influenza. As of November 29th, the influenza-like illness activity remains low, but we are increasing. We're still similar to this time last year. Activity did increase by 2.6% since the last week. There are concerns about the new subclade K variant. That mixed with low vaccination rates could mean for a pretty severe flu season. Experts do say that this vaccine will still provide decent protection for that variant. So we'll see. The CDC also has a website that kind of lists other respiratory infections that are not COVID, flu, or RSV. Currently, mycoplasma pneumonia and pertussis are listed. I am seeing a few pertussis cases sprinkled in every week or so, or our area. Is that time for norovirus, leading cause of vomiting and diarrhea? NBHHS did release their updated guidance that included a long-term care checklist and some testing guidance, and that was all shared out to our facilities. I did include a link to a nice fact sheet on norovirus. Main takeaway is use soap and water, antibacterial. It's not going to cut it. Becky talked about our vaccines. We still have plenty available, along with some free flu and COVID. She talked about the National Vaccination Week. We had a few people show up for that. Not a lot, but still good. We have been working for a while with the state for some increased HIV cases in our region. The Bureau of HIV and STI program did kind of start a subcommittee, and that includes local health departments, health systems, HIV care teams, and disease intervention specialists. Some of the goals just include like stronger collaboration, help improve linkage to care, and then focus areas, increase HIV awareness, help retention and care, making sure they're still continuing getting the medication that they need. Our first meeting was November 19th, and we will be meeting quarterly. As far as WIC, upcoming food pack changes, about March, they're looking at increased fruits and vegetables, additional yogurt and fish, and expanded whole grain options. Children's Special Healthcare, they have been working to start using our current electronic medical record, Nightingale Notes, to use for their data entry. So they're working on transferring old and current cases into this. Hearing and vision, they're still having ongoing issues with finding optometrists that will accept Medicaid. So these families are getting referrals and they just can't find providers. So that takes us a lot of their time helping them find those resources. COHOD's is still working to increase patient awareness on the program and all that entails. And they're working at just additional communication methods and trying to ease up the paper that's needed for that.
Questions?
Your handouts, or do you have a single page of report of
What?
or
Yeah, that,
reference
I can
guide?
get that for you.
That'd be helpful.
There's a whole bunch.
Yeah, okay. And is it reportable to local health department?
Yes.
Yes. Beautiful.
Yep.
Thanks.
Yes, I got the numbers in here are for the month of October.
I think it is October and November.
Okay, so, thank you. Right, please.
That's your question. Moving along here, we're up to financial reports.
Great, good morning. You have the payments before you. You'll notice on page 36, there's our Johnson Builders. That's the final payment for the Hillsdale Building exterior renovation project. Other than that, pretty standard stuff. I would be happy to answer any questions you have.
Was that option? I was asking you if I wanted.
If they're gonna vote, but I'm gonna vote to pay the bill. Thanks for bringing that to my attention.
Yeah. that's- Pay the bills. Discussion. Hearing none, all those in favor say aye.
Aye.
Any opposed? Here. What are financials?
All right, moving along, you have the balance sheet in front of you, the cash disbursements and receipts, and then how we're doing. And I noticed as I was sitting in the meeting this morning, there's a typo on page 39 and 40. The heading at the top is total budget. It says final. It should say original. So this report is comparing how we did based on our original budget. Once we pass the amendment next month, you'll get the amended budget, which I think will be closer, and hopefully there won't be as many things that are out of whack. But budgeting is always a interesting challenge. So we are slightly under budget, less than 1%, but we are under budget at this point, and I'd be happy to answer any questions you have.
I'll do that. I would move to approve the financial statements.
Support. Okay, we have motion for support. Questions? Hearing none, all those in favor say aye.
Aye.
Any opposed? Carries. Okay, we're up to finance committee report.
There were two of you there.
You took the
Everybody got the report in front of them. We went through the whole thing. There's a few things we got discussed later toward underneath business, but anybody has any questions, how the finance committee, Kevin can it'll help. Anybody have any questions?
I will look at it.
Figure you would.
Make a motion, we approve the finance committee meeting minutes as presented.
Support.
Okay, we have no support from the finance committee. That was a great presentation, by the way, so. Let's get discussion on this. Hearing none, all those in favor say aye.
Aye.
Opposed? Carried. Grant policy.
We did not meet.
Thought I'd give you a chance to say that.
Yeah,
All right.
we meet next month. I won't be there.
Okay.
It's
Let's get to that.
all right. So we have no unfinished business. We're on to new business. AAA DPW health project.
So the same summary that I shared with Commissioner Collins and Commissioner Phelps of the Finance Committee is included in the packet. And we've covered a number of the highlights. And if you have any additional questions, our providers are ready to go. Again, based on the conversations we've had with them all and questions we've answered, we really want to let providers determine what's going to be most helpful for their team. And we've gleaned the number of staff that they have, whether part-time or full-time, and are dividing it up accordingly among all the providers that have eligible staff that serve clients in our region, and or for example, both Commission on Aging, as you can imagine, have the most staff, so they're going to receive the largest chunk of these dollars because we based it on I just did simple math to divide the $18,000 bucket by the number of team members they have, and we're going to put it out that way. This was the approach that I took.
Okay, so we have to formally adopt this or approve it.
Yes, please.
Support. Approve the DCW health project. Sounds like a great program. I think hopefully help a lot. discussion, all those in favor say aye. Okay, on the 25.6 budget amendment. Number 1.
So before you, you do have the budget amendment number 1, and this takes into account all of the information that we didn't have available at the beginning of the year, back in June when we did the original budget. We have a pretty, much better idea of what funding we are going to get now. So this incorporates all of that, and I would be happy to answer any questions.
Work. Okay, we have budget amendments. Discussion. Hearing none, all those in favor say aye. Motion carries. Employee compensation.
This is going to take us to. So, before you, you do have a proposal. We are recommending a 4% increase. We understand that that is a little bit higher than what the inflation rate was. And the reasoning behind that, there are a couple of reasons why we have recommended a 4% increase. The first one deals with the minimum wage. So Michigan approved that minimum wage raise law, and the minimum wage will go up to $13.73 on January 1st of 2026, which we do not have any problem meeting. We are there. Even the bottom of our pay scale meets that level. The problem, however, comes in the $15 an hour by January 1st, 2027. And if we do not take action, we are not going to meet that $15 minimum at the lowest part of our pay scale. So right now we are approximately 7.5% from where we need to be. If we're going to be there by January 1st of 2027, at the bottom of the scale being $15 an hour. So we're taking it in chunks. We are proposing 4% this year, and then we'll have to follow that up with another 3.5% next year to get the bottom of the scale to what is the required minimum wage. And the other part that I like to point out is that if you look at the chart on page 62, this is kind of the proposed with the 4% increase in that column that has the yellow in it. Then the column that's pink is a salary study that was done in May of 2023, and it lists the health departments that participated in that study. And then there's also Mouth did a study in 2023 as well, and that's in the column in blue. And you'll notice that the column that has the yellow in it, there's still a number of positions where the wages are less than what the average of these salary studies were back in 2023. Even with this 4% increase, we're still lagging behind in a number of positions for what the average was back, a couple of years ago. So I think that that's important to point out as well. And I'd be happy to answer any questions you have.
The figure to use for Brad St. Joseph, is that the top rate, is that the mean rate, is that the?
All of the figures on this, on page 62, are the average of the top. So we used only the top of the scale because different scales have different number of steps. So I used the top out number to compare them.
Does our budget reflect 4%?
The budget that you just approved reflects a 4%.
More than half.
Yeah.
We have a function of government limited us to necessarily what we can see for increased revenue. Each of our counties, are limited as to what that increased revenue is, either through increased development, so you see an increased property tax revenue, or the rate of inflation. And the property tax rate of inflation is 2.7%. That is the inflation factor that Hillside County applied to our general fund employees for their wage increase. I have a hard time saying, well, we have to increase it by 4% just because of another stupid state law.
Well, and I mean, I understand what you're saying there too, logically, I understand why you would wanna like separate it and take it into chunks. That affects kind of the lower part of our, I mean, I don't know how many employees that would be affected by that minimum wage 150. We have a number in that,
There's one person that's in that salary scale.
but clearly a 4% increase across the board affects just that. I don't think it's too far out line. Typically right around 3%.
Building guard budget. Yeah, I don't think 4% out of line. Tough position or tough field to get people to.
Do we have to approve this separately? We go with the-
That was 4% tough.
Support, okay, motion support for further discussion.
Just back to that, I think that maybe it's time we would, if that's our concern, and we have that minimum wage $15 an hour, maybe it's time we just look at changing that lowest classification and then look at adjustments in that increase from level to level.
And we did discuss that, but my concern with that is it then, if you can be at McDonald's and make $15 an hour, and our positions that are higher than that aren't going up because we're not meeting that, sending everything upward, it shrinks the difference between a college educated position and somebody that has no education. And I think that will make it very much harder for us to recruit staff members that are qualified. And we have so many positions here that require college education. And it's hard for us to recruit people already. So I don't necessarily want to shrink that together.
Yeah, so that's, I mean, that is always a challenge when wages increase and you don't control it. Economists call that a compression mechanism. But clearly we're adjusting the entire scale for one position, right, or one scale. So, but it's challenging, and I agree that you have a state law like that that tells you have to do this, right? But it does. I feel like the market should determine how that happens, I guess. But
And that's why all McDonald's are going to automated, because they're not gonna pay $15 an hour for somebody saying to take your order back.
That, and I could see it not doing it, not moving it to 15 if we had 25 or 30 positions. But you're talking one position. If that one position makes it harder to hire people, that
I think the compression is the issue, though,
Yes.
right? I mean, so you move this person. then
yeah,
people
I
that
mean,
are,
but
like,
you're only
higher.
talking one.
Yeah,
I
right.
mean,
I
you're
know what
not
you're saying.
talking moving.
But it's the others that are near that's the problem, right? If you don't bump them up, then you have somebody that could have a college degree and like gone to school and worked here who knows how long.
Make
It's
it,
close to that 15, right?
and that's where I would question that, should that environmental health authority go through and restore that, make sure that it still should be a level one and not a level two position. Which solves that situation.
Sure. Yeah. Always can. Further discussion? Right.
Would you like a roll call vote on this?
Sure.
Commissioner Hoffmaster?
Yes.
Commissioner Houts?
Yes.
Commissioner Leininger? Commissioner Collins? Commissioner Schaefer?
Yes.
Commissioner Stoll?
Yes.
Thank you.
Motion carries.
And just for, not that I don't believe that we need a rate adjustment, I just, knowing what we're gonna see for increase or decrease in revenue at the county level, just we have to have, outlay, see.
I mean, the legitimate concerns I can go around.
So,
Okay, all right, move on to the health.
Right, so, so you have two things there. One is the write-up that was prepared for the finance committee. And then, draft contract, starting on page 67. This is a 3-year, term that would conclude on December 31st of 2028. This, proposal also took a look at the materials that were presented on page 62 and includes information about that average. And then I collected a couple of district health department salaries for information so that we could get the 2025 number instead of the 2023. And both of those district health officers' salaries are higher. And I gave you some additional information. In the one case, that gentleman has been health officer longer than me. His population is smaller, but he does have a larger geographic area for his district. Whereas the other health officer, she has fewer years of service, population smaller than us, and fewer square miles than our jurisdiction. So just a couple of information points to capture 2025. So the other thing that is changing or I'm proposing changes in this contract is the merit pay portion. So as you're aware, the merit pay has been a part of the contract after the evaluation. Should a positive evaluation occur, then there's an eligibility for merit pay. That has been in my contract the entire time that I've been the health officer. That does cause some issue here with our staff. They don't understand why when they have an evaluation, they aren't eligible for merit pay, but the health officer is. So there is some consternation created as a result of that. And if we are, continuing to try to promote an organization that's cohesive and equitable with compensation practices, I'm proposing that be removed at this point. I have received all positive evaluations for this is the end of my 10th year since I took this position. I feel I have a 10-year track record that shows that you should expect similar results over the next 3-year period. So I am suggesting that just be eliminated for those reasons. So you can see there finally on page 66, the current total compensation for 2025 puts me at $117,339.50 if you include the merit pay, and a 4% if that is used as it was just provided to the agency staff would increase that to $122,033.08, which still leaves this health officer position significantly underpaid in comparison to my colleagues. So that is my proposal for you.
The finance committee did look it over. Was okay with for the presentation. I've been on the board. The merit pay was always kind of an issue that we had to discuss. So I think it is fair to roll into the salary. I have no issues with the 3-year contract.
Is that a motion?
That's a motion to accept the 3-year contract. Thank you very much, Temper.
We have motion supported. Is there any discussion?
Question, and back to your comment about some of the staff, but one of they don't get merit pay.
Right.
Do our staff automatically increase in up their wage
Steps.
every year, or is that based on the a satisfactory performance evaluation.
The steps happen regardless.
So,
Up to step 7 and then they're done, right?
unless they advance in level.
Unless they advance in level, which there are few opportunities for that here.
But they're not done technically. If we give a raise,
That's what they get.
they'll get a pay raise.
That's correct.
That's the misunderstanding of that whole step thing. Is that, oh my God, when I get to the step 7 or step 10 or whatever,
Right.
that I'm not gonna get a raise. You still get the raise that is
Right.
adopted for
You know,
everybody at 1 or 2 or 3.
Right.
so to me, that's the argument back to the employees that, well, I get evaluated, but I don't get a merit pay when I'm done. Yes, but as long as you're not terminated, you're going to increase in that,
Mhm.
wage schedule that you're on already.
Plus the world's not fair.
It's not, if the world was fair, everybody would be paid the same wage. And
The same one. Yeah. Same.
and that doesn't happen. I like the merit pay in there because to me, it help make that health officer maybe a little more responsive and to the body, making sure that we're still going through that evaluation process. And there's a benefit for making sure that through that evaluation process, the Board of Health is still on board with the actions and the work that health officer is doing. So me, I would still much rather have the merit pay included. I understand, but
I can understand that too, but as Rebecca mentioned, I think there's been high marks for the 10-year period. We have no reason to believe that won't continue, and I don't get there'll be a drop at all in this.
I also don't like the 122.033.08. Sort of way to,
How does that not surprise me that you don't like that?
round it off, make it a simple.
That's the way it works.
No pennies no more.
We don't have that.
No pennies no more.
Unless they're electronic.
We're down to all the other employees too around them all.
All right, is there any further discussion?
The only concern I have, and I thought of it after our meeting, was future medical health officer that come in. And that's not in there. Say you don't,
Redo their contract.
Yeah, we'd have to just
Yeah.
negotiate all that anyway. So.
that would be
Maybe
my
like the
only
merit
concern.
increase isn't in there, is that what you're saying, or?
Well, for a new person, yes,
Yeah.
I would say that would be something
I agree
that
with that.
is needed. I mean,
That'd be in a
because if
situation.
they come in and do a
Situation, I think that could be. Yeah. In Rebecca's situation, she's been here a long time, she's done a nice job, so.
What to worry about that for 3 more years.
That's right.
Well, that's those 3-year contract,
I might ask for another contract after this one. I mean, we don't know, right? The merit pay is unusual
Sure.
for health officers of Michigan. It happened here, it has maintained here, but when I talk to my colleagues, they don't have this.
Yeah, it would be an unusual, in the public sector, yeah, private sector, that certainly does happen. But yeah, I think that's right.
You're good with it, I'm good with it.
I'm with Commissioner Leininger. I like the merit pay, and I know Becky's done a great job, and I'm for this in particular, but I do like the merit pay. And we did eventually, after 20 years, Rebecca decides to call it quits. When we redo the contract, I think the merit pay is a really good thing. And I'm sure when they originally did this, they set the salary and said, oh yeah, by the way, on top of that, you have an incentive. It's not like, hey, we're going to take away $5,000 and hope meet these expectations. It's usually on top of your salary, and by the way, this is the goal you have, and if you reach that goal, you get a bonus, right? That's how it is in the private sector.
Yeah.
I personally think that's good.
And it is, it's exactly what you said, it's an incentive, yeah, and I agree with that too, and Mr. Collins' comments as well. You know, that makes sense when somebody's like thinking where they're.
Yeah.
Okay, further discussion? How about a roll call? Yes, move on.
Commissioner Hoffmaster,
Yes.
Commissioner Houts.
Yep.
Commissioner Leininger,
No,
Commissioner Collins,
Yes.
Commissioner Schaefer,
Yes.
Commissioner Stoll.
Yes.
and back in that, you know, I think you understand my thought, my concern. I would have rather had that mayor vacancy.
Completely understand.
Okay.
Thank you.
All right, so we're up to community health improvement / strategic plan.
So hard to believe, but it's time to start this process again here at the agency. Community health needs assessment is a review of the needs that we do have in our three-town area. We talked with Mary about the CHNAs, Chinas, I will call them, that have been done in our local hospitals. We're gonna utilize those because they're very fresh and new from Hillsdale and from Beacon and Three Rivers. And then we would gather some additional input in our Branch County area because Insight has not a ProMedica before. It's been a while since they've done a China. So we will utilize the information that's available. We're not going to recreate, in other words. We've also reached out for the surveys that the Great Start Collaboratives have done in recent years, as well as our community mental health providers. So using that information, we'll put together a new community health needs assessment. We'll then create a community health improvement plan. And then once we have all of that done, we need to enter into strategic planning for the agency because we are wrapping up currently our strategic plan. So, but we need to do this other part first so that that can inform where we need to go with our strategic plan. Mary is proposing all of this work to be done for $19,120 with, as you can see, some additional costs for travel, but travel is going to be very limited. There won't be a lot of travel here. And that's a lot of work for $19,000. So I am suggesting that we accept this proposal and that will allow us to get started down this road in 2026.
Motion to accept the proposal.
Support.
What's the scope of time?
We will be wrapped up by the end of 2026. We may even be wrapped up by the end of this fiscal year on September 30th. So because a lot of the work has already been done with regards to the CHNA piece, that timeframe is sped up significantly.
Others may know this, but it's qualifications.
Sure. So Mary is a former health officer in Michigan who is now a employee at Central Michigan University and teaches students in the Masters of Public Health program. So she has a master's degree in MSA. She has an MSA. So that is her most recent work experience.
You know, he has acute care experience.
I don't think so. Yeah.
And has she done this for other counties?
Yes. Yeah, we tried to engage her for this entire package last time we went through this. She didn't have time to be able to do all of it. So she worked with us on the strategic plan part. And then we worked with Marcus Cheatham, and he helped us with the CHNA and the CHIP. I don't know if you guys remember meeting him. He came in and did a presentation for us when he was working with us. So
I'm sure he's very qualified and just curious.
Yep.
So I wouldn't certainly get in the way, just
yeah.
confident. Other discussion? Hearing none, all those in favor say aye.
Aye.
Opposed?
And there's a lot of things here. Well, that was done at our financial committee. that we did all that. So I knew I just wait to the end of the meeting and we cover everything. Speeding things along.
That's a good thinking. That's good thinking. All right, so we're up to the Board of Health meeting schedule. for 2026.
So there's some things we need to talk about here, right?
Yeah, I mean, I always add it to the end of the last meeting of the year so everybody knows what to expect in January. And at the Finance Committee, they did also move the Finance Committee meeting to January 5th because the scheduled day it would be Martin Luther King Day, which we're not working. And we have that same problem in February, although we did not talk about it at the Finance Committee meeting. That normally scheduled date and time for the Finance Committee would be on President's Day. So that is currently scheduled for the Friday before, which might or might not work for you guys. But we did talk about the January meeting, moved that to January 5th. And everything else is pretty much as usual, other than the February Finance Committee.
And you can see we'll do some board education starting in January. If there is a topic that you're interested in, please let me know, because otherwise we're gonna figure it out for you. So, and it, may or may not meet your needs. So I would prefer to do something that you want to hear.
And if you do want to, if the Finance Committee wants to talk about the February meeting, now might be a good time. And I say that because we're kind of down in the middle of December. The January Finance Committee meeting is scheduled for the 5th of January. And right now I have nothing on the agenda for that meeting, which means it may be canceled. So you may not meet again until the January board meeting, which it would be fine to discuss at the January board meeting too, if it doesn't work for you on the Friday before for February 5th.
When are we doing budget amendment 2, Trace?
Budget Amendment 2 will be done in May usually, May or June.
Tell me.
Yeah, it'd be May or June. Depends on how fast information comes through.
Do we need action to go through this today? Because that technically would be a change. I don't think we have approved the even January meeting date for the committees yet. Because if we went back and looked at last year, there would be
Yeah, the committee meetings were not on the schedule last year, so they have not been approved by the board.
so I wonder if we should, because you don't have the January 27th committee meeting, you have the January 27th board meeting, but you don't have the January 27th committee dates on here.
Well, you name your committee members at the January meeting. So until you meet on the 27th or 22nd, if you're going to
But-
change committee,
Right, but the committee would still commit to who was.
who was on it before, which because it's a 2-year term for all of you, I believe you're all coming back. So I think we're good for this.
26, right, 27 would be.
Yeah, that would make sense.
Well, and I can add those January 27 meetings to the schedule. I'm sure that this will be amended at some point during the year. It always is. I'll make a note to add those January 27 meetings to the next iteration of it, or try to figure them out right now.
What? Well, we'll have the same problem with the.
Yeah, it's always a problem in January and February for Finance Committee because they meet on the Monday that is always a holiday.
And the board
It's a
members are
recurring.
changing.
Yep.
Potentially.
I would move to approve 2026 Board of Health meeting date as presented.
Or, okay, that motion is support. Is there any further discussion?
Maybe gone on the 22nd, so you guys can just make decisions without me, and then I will read it on it.
And criticize them later.
Got it. Sure. That would be nice.
Very much.
We'll miss you.
Yeah.
All right, any further discussion? All those in favor say aye.
Aye.
Opposed? Yes. All right, we're up to public comment again. Sure comments. Sure comments, let's start. Okay. All right, Chris, stand everybody. You too. Commissioner House.
I don't have anything at the time, but I will defer to those later.
April. Merry Christmas from St. Joseph County, right?
Absolutely.
That's all I got.
Good to see you again.
Yes, thank you. Good to be seen. Appreciate
Commissioner House, safe travels and make your way back and forth south here now. Hope everybody had a very blessed and Merry Christmas. We will see everybody in the new year.
Oh, beautiful.
It's in chair too.
Yeah, that's right. That's right.
That's the second one I make.
All right, I would entertain a motion to adjourn.
So,
Support. Promote support to adjourn.